Welcome to the deep dive. Today, we're really getting into something significant, a challenge many face. Fertility issues linked to endometriosis.
That's right. We've got some compelling sources here, and our focus is squarely on complementary approaches, specifically how acupuncture and herbal medicine are showing real promise.
Yeah, not just for, like, pain management, which is huge in itself, but for actually improving fertility outcomes.
Exactly. The evidence points towards them tackling the root inflammatory issues that often persist.
Okay, so let's define the problem first. Endometriosis tissue, like the uterine lining, but growing outside the uterus, causes awful pain, heavy periods, and the big one for our discussion, trouble conceiving.
But here's the crucial point our sources really hammer home. It's not just about that misplaced tissue you might see on a scan.
Right. It's what happens because of it.
Precisely. Even after surgery, like laparoscopy, to remove the growths, there's often residual tissue left behind. Tiny bits, maybe.
And these leftovers, they're not dormant.
Far from it. They act like tiny, persistent inflammation generators. They pump out these pro-inflammatory signals, cytokines, things like interleukins, basically creating chronic inflammation in the pelvic area.
So the real barrier to getting pregnant isn't just a physical blockage. It's more like an inflammatory battlefield.
That's a good way to put it. The sources call it a hostile uterine environment. It interferes with the egg implanting properly
Hinders conception itself.
and critically destabilizes things, significantly upping the risk of miscarriage, especially early on.
Okay. So this deep dive is about understanding how these complementary therapies, acupuncture, herbs, go right after that mechanism, the inflammation itself.
Yeah, because conventional treatments, while vital, often focus on the tissue or hormones, maybe not fully resolving this underlying inflammatory state that lingers.
So section 1, let's really dig into that inflammatory barrier. What's it actually doing to make things so hostile for fertility?
It's quite specific, actually. These inflammatory cytokines, they trigger something called oxidative stress that's damaging to cells, including eggs and sperm.
Right.
They can directly impair sperm function, their ability to swim or fertilize,
Wow.
and they disrupt the delicate hormonal balance needed for the whole process.
Right.
Ovulation, implantation, everything. It's a cascade effect.
So this inflammation isn't just general irritation. It's actively sabotaging multiple steps needed for pregnancy.
Exactly. And that confirmed inflammatory state is why fertility can be such a struggle with endo.
Now, conventional options like hormonal treatments or repeated surgeries, they have their place, but they can be tough. Side effects, maybe not a permanent fix.
Right. And that's where the interest in complementary approaches comes in. Our sources position acupuncture and herbal medicine as offering perhaps a gentler way.
A more sustained approach, maybe. Something that manages the chronic nature of this inflammation.
That seems to be the idea, turning down that inflammatory volume to create a more supportive environment for conception, potentially with fewer harsh side effects.
Okay, that leads us nicely into section 2, acupuncture. We often hear about it for pain, which is a huge benefit.
Absolutely. Quality of life improvement right there.
But how does it specifically target the systemic inflammation we're talking about? The mechanism is simple, right? Needles stimulating points.
Yeah. Thin needles at specific points trigger physiological responses. And the evidence for pain reduction is solid. Studies show significant drops in pelvic pain.
And specifically for period pain, dysmenorrhea.
Yes, research indicates it reduces the intensity and duration by regulating inflammatory things like prostaglandins.
But here's where it gets really interesting for fertility. The study suggesting it impacts the markers of the disease itself, not just symptoms.
This is key. Research demonstrates acupuncture can lower serum CA-125 levels.
Which is a major inflammation marker used to track endometriosis activity, right?
Exactly. Seeing CA-125 go down suggests the treatment is reducing that underlying inflammatory load systemically.
And it goes deeper, like down to the cellular pathways.
Apparently so. Some studies, including animal models, show acupuncture actually downregulating key inflammatory pathways. They specifically mention the P38 pathway.
Wait, so it's potentially changing how the cells are signaling inflammation? That's more than just masking pain.
It suggests a regulatory effect, doesn't it?
Yeah.
It's dialing down the inflammation at a more fundamental level.
So the thinking is, by reducing this inflammation, both locally in the pelvis and systemically, acupuncture could make the uterus more receptive.
That's the hypothesis. A less hostile environment, better chances for implantation, maybe lower miscarriage risk. It's about enhancing that uterine receptivity.
Okay, powerful stuff. Now, let's switch gears slightly in section 3. Herbal medicine. How does this fit in?
It complements acupuncture. Traditional Chinese medicine often uses complex, tailored herbal formulas. The goal here is not just tackling inflammation, but also addressing the hormonal imbalances that often go hand in hand with chronic inflammation.
So a two-pronged attack, inflammation and hormones. What does the evidence say about actual pregnancy rates?
Pretty compelling, actually. Meta-analyses have found that specific Chinese herbal medicine protocols improve pregnancy rates in women with infertility,
And the mechanism is thought to be,
reducing that inflammation and oxidative stress, directly countering the effects of that residual tissue we talked about earlier.
how does it compare to, say, standard hormonal treatments?
Well, some comparative studies suggest that staged herbal therapy, where the formula changes depending on the menstrual cycle phase, can be as effective as hormonal treatments for endo-related infertility.
As effective, but potentially with a different side effect profile.
Exactly. And the anti-inflammatory properties are seen as key to supporting a safer conception environment.
Safer conception.
Yeah.
And does it help maintain the pregnancy, too? Miscarriage is a big concern.
Yes. Research indicates that certain herbal interventions, when used appropriately in early pregnancy, can reduce miscarriage risk.
How? By keeping that uterine environment stable.
Precisely. By continuing to manage the inflammation, creating a more stable foundation for the pregnancy to develop, and importantly, studies note minimal side effects.
That's a huge plus.
Yes, silly. And there's more. Some studies link herbal medicine to a lower recurrence rate of endometriosis lesions after surgery.
Really? So potentially longer-term benefits, too.
It seems so. And other research points to specific compounds in herbs, like polyphenols, which might help modulate both estrogen activity and inflammation. It's quite sophisticated.
It sounds like these herbs aren't just masking symptoms either. They're potentially influencing the disease process at a deeper level.
That's the perspective these sources offer, yes, targeting those inflammatory drivers.
Okay, so we have acupuncture regulating inflammation systemically, and herbal medicine tackling inflammation and hormones, often in a cycle-specific way. Section 4. How does this all come together in practice? Integration.
Well, the synergy is pretty obvious, right? Combining them potentially amplifies the anti-inflammatory effects. It offers a really holistic strategy, especially for managing that situation after surgery.
A combined approach to turn down those cytokines, shift the uterus from hostile to stable.
Make it receptive, yes, and ready to maintain a pregnancy.
Our sources mention centers that specialize in this, pioneers in complementary care for fertility.
Yes, like the Berkeley Center in New York. They were apparently the first U.S. complementary medicine center focused specifically on fertility challenges, started by an acupuncturist, Mike Berkeley.
And his approach developed over, what, nearly 3 decades?
Yeah, refined over 27 years. It's built on 3 pillars, integrating the kinds of things we've been discussing.
Okay, what are the pillars?
Pillar 1 is acupuncture, focused on blood flow to the ovaries and uterus, balancing hormones, and that crucial inflammation reduction.
Makes sense. Pillar 2.
Customized herbal medicine, tailored to the individual to combat oxidative stress, reduce inflammation further, and support uterine health.
And the third pillar is interesting. It brings in technology. Low-level light therapy, LLLT.
That's right. It's often used in a series, maybe 12 sessions or so. The idea here is to improve egg quality.
How does light improve egg quality?
It's thought to work at the cellular level, promoting energy production and repair within the cells. In these protocols, it's often paired directly with acupuncture sessions.
So, acupuncture, herbs, and LLLT. A comprehensive package aimed squarely at overcoming those inflammation-driven fertility issues in endometriosis.
Exactly. It shows how these therapies are moving beyond just alternative options into strategically integrated components of care for this specific problem. They even offer specific packages, like for pre- and post-embryo transfer.
Okay, so let's synthesize this. We've looked at the inflammatory barrier, how acupuncture targets systemic inflammation markers like CA125 and pain pathways.
How herbal medicine adds hormonal balance and tackles oxidative stress, improving pregnancy rates and stability.
And how integrating these with things like LLLT provides a multi-pronged approach. When you pull it all together, the evidence seems to point towards a very clear strategy.
It really does. It's about targeted environmental transformation. Reduce the inflammatory cytokine load, shift the uterine environment from hostile to stable and receptive.
And the outcomes reported are better quality of life, improved fertility, and importantly, with minimal side effects compared to some conventional routes.
It strongly suggests these therapies are addressing a root cause, that persistent inflammation, not just managing symptoms.
Which leads us to that final thought, something for you, the listener, to consider.
If the core problem driving infertility in many endometriosis cases is fundamentally inflammation,
Then how much does the success of these complementary approaches challenge the traditional view? The view that surgery or potent hormonal drugs must always be the first and primary line of defense against endo, especially when fertility is the goal.
it definitely gives you something to think about regarding how we approach chronic inflammatory conditions and fertility.
Absolutely. Lots to mull over. Thanks for joining us for this deep dive.
We'll get you next time.